We are very excited to be here today with Dr. Gemma Newman. Now, Dr. Newman has worked in medicine for 14 years and is the senior partner at a family medical practice. She studied at the University of Wales College of Medicine and has worked in many specialties as a doctor, including, but not limited to, elderly care, endocrinology, pediatrics, OBGYN, psychiatry, general surgery, urology, vascular surgery, rehabilitation medicine, and general practice. In other words, there's nothing that Dr. Gemma Newman doesn't actually know. She has a special interest in plant-based nutrition and gives nutrition and lifestyle advice to her patients who have gained tremendous results using the power of their plate. She's a broadcaster and she's a writer, and she's been regularly featured on television, including in the United Kingdom, on Channel 4, Channel 5, Sky News, and Sunrise. She's contributed to articles for magazines including Glamour, Zest, and Healthy Magazine. She's also teamed up with the online media company Plant-Based News to bring the plant-based nutrition message to the public. She is regularly invited to teach on other doctors via training programs and conferences about the benefits of plant-based nutrition. So we are very honored to be with you today. Thank you so much for being here today with us, Dr. Newman.
Thank you, Cyrus. Thank you, Robbie. That was an amazing introduction. Thank you.
Glad to have you here.
You guys do great work, so it's a real honor for me to be here too.
Well, fantastic. So we got a whole slew of questions for you today. Let's start at the top here. What made you decide to incorporate plant-based nutrition into your medical practice?
I love learning about how to help my patients. It's my passion. And on a personal level, I've tried all sorts of different ways of eating just to see if I can get to truly understand what kind of works for the human body. And in the past, I've managed to lose weight myself by cutting calories and doing calorie counting. And I went low carb for a while and increasing my exercise and getting good sleep patterns and all these different things, which worked to help me feel better and to lose weight. But being a younger doctor, I was still in my 20s at that time when I was experimenting with all the different things. And I tested my cholesterol and my lipid profile, and I was shocked to find that I had a poor lipid profile. And I know that with my family history, that was going to be important for the future. My father died young of a heart attack. His father died young of a heart attack, and I wanted to be there for my children. So on a personal level, I thought, well, at the time, I was a bit fatalistic about it, to be honest. I thought, well, I've tried everything. I'm in peak physical condition. I'm super fit. I exercise all the time. There's just nothing I can do. And I'm just going to have to live with the fact that, after a certain amount of years, I'll just have a heart attack and I've got to make the most of it. But, at the back of my mind, I thought maybe there's something I can try. And then again, I think a lot of the time, even for doctors, it always comes from personal transformation or personal pain or some sort of personal experience. I think my husband was training for the London Marathon and he was getting injury after injury and he wanted to try and sort of solve that. So he started to do his own research. He's not medical, by the way. He's not at all medical. So he said to me, "Hey, Gem, check this out. Look at this book." And I was like, what are you looking, what are you showing me? And it was Finding Ultra by Rich Roll. And then I was hooked. I thought, okay. So this isn't, something that will cause deficiencies. This is something that could actually improve performance. So I read about Brendan Brazier and Thrive, and I read about Scott Jurett, Born to Run. I thought, okay, well, these are all athletic books. What about science? What about evidence? What about studies? And so then I delved deep and I just kept reading. And the more I read, the more I understood that a whole foods plant-based approach to eating helps on a cellular level. It helps on a population-based level. It helps on every possible level you could imagine. So I decided to give it a go, and lo and behold, in just less than 4 weeks, over 10 years later, with 2 kids and a busy professional life and exercising half the amount, I've got normal lipid profiles now. And I think having the confidence as well of the evidence base behind you really helps. So I recommended it to my family, and they had benefits from reduced arthritis and reduced diverticular disease and reduced recurrent dental abscesses. And my mum, bless her, she was getting dental abscesses all the time, and she started to eat more this way, and now she hasn't had one for a long time. And there's just so many sort of personal experiences that kind of all build up to then you finally having the confidence to recommend it. And so when I started to recommend it to my patients, it was mind-blowing. they were getting incredible results really quickly as well. So again, it's just building up the evidence base and also your own personal experience, because at medical school, we're all taught so much data. There's so much to learn. You learn about the the cellular biology of disease. You learn about anatomy, physiology, pharmacology, different medical subspecialties, communication skills, consultation skills. There's so much to cover. But lifestyle medicine, preventative medicine was never discussed. It was just, the assumption was that your body starts to fail. The human body is deficient in some way. It breaks. And then you have to be a good diagnostician. You have to try and fix it, and you use your skills of history taking, examination, investigation to get to the truth of what the diagnosis is. And then you give people pills, and then you give people operations, and you really sort of do something to fix them. But there was a cursory mention of saying things like, diet and exercise, but there was never any advice on how, never any advice on what. So you just sort of left floundering. I mean, I think. And we take heart disease, for an example. I think that's one of the things that's very much related to diabetes, because diabetic people are generally more prone to heart disease, obviously. That kind of approach is typical. So, you get to the diagnosis and you think, okay, pills, procedures, statins, angio, bypass grafting. And yet, we know that about 20% of people get side effects from statins with muscle aches, and potentially get increased risk of memory loss, and there's actually increased risk of diabetes, as you may know, from taking a statin long term. But you don't necessarily look at the other potential problems with that. And if you're a low risk person, you've got to get around 1,000 people taking a statin for 5 years to prevent 6 heart attacks. So you just think, is it a really good trade-off? And other procedures like angio as well, you think, the American College of Cardiology say now that they don't recommend it unless you're in the first 24 hours after a heart attack, because it doesn't really help as a prevention. And even cutting open your chest wall and getting a surgeon to operate on your beating heart, it works, but it's really extreme. Whereas if you know that you can have a whole food plant-based diet and these kind of lifestyle changes and prevent that, then that's surely the way to go.
I love that you have brought up the topic of cardiovascular disease. So that's one thing we want to know about. Why is a plant-based diet so great for vascular health? You have a lot of experience working in vascular surgery. Can you give us a little more insight into that?
Sure. I was in vascular surgery unit, and it was tragic, to be honest. I saw a lot of people living with diabetes and heart disease and peripheral vascular disease. They were having toes, mainly lower legs, sometimes upper legs amputated, and quite often they'd start with one amputation and the gangrene would keep spreading, and they'd have to have another procedure and another. And it was a very depressing specialty because people never got better. And also, we never discussed diet. We never discussed diet during that block. So when I was on that job, it was just never even conceived of. But it's so important because we know that underlying inflammation is key to heart disease and peripheral vascular disease, because it's all caused by underlying atherosclerosis, the hardening of the arteries and the inflammation that occurs in the arteries. So you've got this arterial wall, you've got the endothelial lining. It's a very thin layer, and it's really helpful for us. It produces nitric oxide. It can be very responsive to stimuli. It opens, it sort of swells and constricts. But when you have heart disease, it gets very stiff. It fills up with plaque. And there are a number of reasons for that. And you have cholesterol going through the bloodstream, and those small dense LDL particles can stick to the side of the arterial wall. And they do that with the help of other toxins and other precursors of inflammation. One in particular that I was going to discuss is TMAO. Should I discuss what TMAO is, or do you think?
Yeah. Let's go into it actually, because TMAO is something that a lot of plant-based physicians are talking about. Dr. Greger's talking about it. Dr. Osfeld's talking about it. So why don't you give our listeners a little bit of an introduction into what TMAO is, what foods promote TMAO production, and what results happen when there's an elevated TMAO level in your blood?
Sure. So when you eat meat, when you eat eggs, when you eat dairy products, basically any kind of animal product, they will contain carnitine and choline. Eggs especially have a high choline content, and other animal products have high carnitine. And these are macronutrients, but in excess, and certainly when you take them through your diet in the form of animal products, what happens? Well, they get digested, they get fermented, they go down to your gut, and your gut bacteria do a grand job of fermenting the food. And what they do when they're fermenting it is they cause the release of something called TMA, trimethylamine. And that in itself isn't particularly harmful, but your body has to process it. So it goes to the liver. And then what does the liver do? The liver turns it into TMAO, trimethylamine oxide. And that is toxic, unfortunately. I think it's, especially with heart disease, but also with kidney disease, it's a toxic combination of having these high levels of circulating cholesterol, LDL cholesterol, combined with the TMAO, which causes this extra plaque formation, inflammation. It can worsen heart disease, it can worsen kidney disease, it can worsen heart failure. And if you remove that from your diet, then you're basically allowing the space for your arteries to respond again. You're allowing space for your arteries to breathe, as it were. So TMAO is particularly toxic. And I think Dr. Greger, actually, who mentioned him, I think he talked about a study where they were getting people who don't eat any animal products, and they were trying to find out, do they produce the same TMAO concentrations as those that do eat animal products? And they found that, you'd feed a vegan a steak and no TMAO is produced. So a lot of it is mediated by the gut microbiome, and that's really crucial for this particular toxin.
Right. So effectively what you're saying is that when you eat a diet that's high in animal-based products, then your gut microbiome, effectively the population of bacteria inside of your gut, is perfectly, what's the word I'm looking for? It's like it
harvested.
What's that?
Yes. It's perfectly harvested to create the toxins. So exactly. If you don't eat those things, then you have a very different bacterial colonization. And fortunately, if you're having a predominantly whole food plant-based diet, you're going to be having loads of fiber. And fiber is fantastic for your microbiome. It's the main fuel source for your beneficial microbiome. What happens when you break down, I mentioned about when you're breaking down these animal products, when you're breaking down fiber in the gut, you produce short-chain fatty acids, and butyrate's one that most people are perhaps more familiar with, but they are absolutely crucial for good microbiome health. They feed them, they nourish them, they reduce your cholesterol that's circulating in your bloodstream, they reduce inflammation, they reduce cancer risk, and that's what feeds your good gut bugs. It's the dietary fiber. And even if you have beneficial gut bugs and you're not having enough fiber, they can actually become harmful in a way, because they start to eat something. They've got to eat something to survive, so they start to digest some of the mucin lining of your gut, and then that can lead to other issues with inflammation within the gut. So you've got to keep that fiber coming.
I love this. So you mentioned that kidney health is something that is influenced by TMAO production. So I would say in general, definitely confusion about kidney health. What foods are good for kidney health? What foods are not good for kidney health? And then especially people who are living with impaired kidney function, they're told to eat diets that are low in potassium and low in magnesium. So can you shed some light here on what a patient who is living with either end-stage renal disease or some form of kidney disease, what can they do, and how does eating a plant-based diet actually improve their overall health?
I think I'm glad you brought this up, because it causes so much confusion. I saw a gentleman recently with end-stage renal failure, and he and his wife were in an absolute state, because they were saying, we've got to cut our potassium, we can't eat anything with potassium in it. And these foods that contain potassium, they're healthy foods. You don't want to have to cut out melons and oranges and bananas and avocados. These are really healthy food groups. So basically the bottom line with that is I would always aim to, first of all, if you've got end-stage kidney disease, and a lot of people with diabetes may well end up with advanced kidney disease, you must get your labs checked. You must just double check what your bicarb is, what your kidney function is, what your electrolytes are, and then you can begin to make some sensible decisions. Because the good news is you can do something with your diet to improve your outcomes and potentially improve your kidney function as well. So we'll park potassium on the back shelf for now, because the main thing that people need to know to avoid is the so-called meat-sweet diet, actually. So the reason that the animal products can be a big problem for people with kidney disease is because of the animal proteins. The animal proteins cause something called hyperfiltration, and hyperfiltration is it's a necessary thing. Sometimes your body is made to do it. So when you give yourself an occasional excess animal protein load, then your kidneys can usually deal with it. But when you're eating animal products for every meal, so when you're having meat and eggs and things like that, every time you have a meal, and many of us do. Many people decide that a meal is not a meal without a piece of fish or a piece of steak or some egg or some cheese or something. You're putting real pressure on your kidneys. There was a study that researchers did where they gave people some tinned tuna, and they were trying to watch for hyperfiltration of the kidneys, and the kidneys increased their filtration rate by around 36% within 3 hours of that one meal. So if you can imagine doing that day after day, meal after meal, it puts an awful lot of pressure on your kidneys. What do the kidneys try and do? Well, they produce a little bit of ammonia to try and rebalance the acid base. And other researchers have said that maybe one of the reasons why kidney function does tend to reduce over time is because of chronic overproduction of ammonia, just to try and counteract those acidic foods. Because meats also contain sort of sulfur-forming amino acids such as methionine. And again, if you're having to always process these things, because the kidneys do a grand job, they process everything, all the toxins and all of the amino acids, all of the different nutrients. So they've got to keep everything in balance. And when they're constantly having to fight these sort of acid-forming foods, then it does affect function over time. So yeah, I think animal proteins are a big no-no. And I say meat's sweet because the refined sugar and the refined flour also compound the problem. They are acid-forming foods, and they just put more pressure on the kidney. So it's that toxic combination, which is really key to avoid for people with kidney disease. So getting back to potassium, I would advise anyone living with kidney disease that even if they have end-stage kidney disease, as long as they have a normal potassium level, they can eat as many healthy whole plant foods as possible. It's not going to be detrimental to their health. There's no real-world evidence to say that reducing the potassium from healthy foods is going to make any impact on your kidney health. So as long as your potassium levels are normal, crack on and have as many healthy foods as you can. Also, it's worth talking to your doctor, because if you're living with kidney disease and you have a raised potassium, it might actually be better to do a medication review before you start cutting back on your potassium containing foods, because there are certain medications that can increase your potassium, and you may find that they're more harmful for you if you're in a situation of hyperkalemia, high potassium levels. So for example, beta blockers, ACE inhibitors, they both can increase your potassium, and there are certain kinds of diuretics, which are medications to help improve kidney function and get rid of water retention and improve blood pressure, which may actually improve things. So it's really worth getting a medication review if you are living with kidney disease and you do have a high potassium, and it's not a good idea to just cut out the healthy foods. And phosphorus, that's another big thing that people don't talk about enough. Phosphorus is a mineral like potassium, but in excess, it can cause worsening of kidney function and also liver disease. Phosphorus can come in many forms, but if you're having a whole food plant-based diet, interestingly, your body doesn't absorb quite as much of the phosphorus from your whole food plant-based foods as it does from animal products. So again, you're onto a winner there. But if you're having a whole food plant-based approach, I would still advise you to avoid things like juices and prepackaged sauces that have preservatives in, because they will contain phosphorus containing preservatives. And that's really important for people living with kidney disease. Read the packets, make sure that you're not eating anything containing things like sodium triphosphate or anything with phosphate in the title. Basically, it's not going to be good for your kidney function. And that can be things like canned meats, certain baked goods, processed meats, cola drinks, other soft drinks. So there's an emulsifier as well in chocolate. I don't know if you have E numbers over there, but there's an E number, E442, which is an emulsifier, which again contains phosphorus containing preservatives and is really bad for kidney function.
Okay, this is great information here. I want to switch gears real quick here. What is the cause of diabetic nerve pain, and can it be reversed?
Nerve pain is horrific. It's really hard to deal with in medicine as well. Diabetic neuropathy we think it's caused by excess glucose levels in the bloodstream for a long time. It can be toxic to the nerve endings, but it's not just diabetes that can cause it. You can get it from having had shingles or certain nerve injuries, and even chronic kidney disease and things like that can contribute to sort of neuropathy. And it's awful. People are in so much pain with it. It can sometimes be sort of just things like tingling and numbness, but for people who suffer from pain, it's horrific. And there aren't very many easy treatment options. This is the problem that we face. We try different medications, but they don't really work very well. And people are still struggling with it. So I advise people to go on a predominantly whole food plant-based diet, because I've read studies, and I have a couple of patients that have said that they themselves have noticed a huge improvement in their neuropathy pain from adopting a whole food plant-based diet. And there's a study about 20 years ago which showed this to be true. They took 21 people who had severe, painful neuropathy. Some of them have had it for over 10 years. And they actually had them in an inpatient setting. And they said, right, we're going to control what you eat. You're only going to have whole food plant-based options. You're going to exercise for half an hour a day and see what happens. And what they noticed was just absolutely incredible. Of the 21 people, 17 people noticed significant reduction or absence of their neuropathy pain. Is unbelievable. These results were super fast as well. I think the average response time was around 9 days, which is far quicker than you'd expect for any kind of reversal of the damage. So I'm not really sure why it was so quick, but it may be something to do with extra oxygen flow, basically sort of to the blood. But yeah, it was absolutely amazing. And these people, they followed them up, and those that had benefit, they continued on this diet and they lost weight, they improved their insulin usage. I think some of them reversed their diabetes. They reduced their blood pressure meds by about 80%. So what's fantastic about this is that there's no side effects, like many of the medications that we actually try to prescribe, and there's just benefits. So I'd say if anyone's suffering from severe neuropathy, please go for a whole food plant-based diet. You can only benefit. Let's see what happens.
That's exactly right. That's what we always say. In a lot of these cases, you have nothing to lose, only
nothing to lose.
So, okay. So you have created a course called The Ultimate Guide to a Vegan Pregnancy in collaboration with Plant-Based News and Dr. Neil Barnard from the Physicians Committee for Responsible Medicine. So can you give us a summary of what is necessary for a healthy vegan pregnancy?
Well, I can tell you the good news. If you are planning on having a pregnancy and you're going to go for a whole food plant-based diet, it's going to be fantastic for your baby. It's going to be, in my opinion, the optimal way to go forwards, not only to improve your pregnancy and improve your chances of having potentially less morning sickness and less unwanted weight gain, but you're also going to get benefits for the baby. Your baby is much less likely to suffer from things like allergies and the merry-go-round of infections that little kids get month after month in the winter months. And in the long term, you're reducing their risk of heart disease and cancer and all sorts of things like that. So it's a fantastic choice. I think if you're going to go about it as a brand new diet choice, I think you need to do a lot of research just to make sure that you know that you're going to be having the healthiest food options possible. Take your prenatal vitamins, take your B12 and go for it. Get as much variety as you can. Some people that are suffering from nausea, I'd suggest, that's very common in early pregnancy because of the raised pregnancy hormones. I'd suggest it's quite nice to be able to take a plant-based shake, just to sip on it so that you can kind of stave off that nausea, but also get yourself a maximum amount of nutrients. But you don't need to worry too much about what you're eating in terms of the volume, because your body's going to tell you how much to eat as long as you're eating the healthy food types. That's the main thing.
This is awesome. So do you have any tips now for raising children on a plant-based diet? Because you said, I think you have 2 children of your own, correct?
I do. 2 little boys. And I'd say my best tips are really just to get them involved. I think if they know what you're aiming to do and they're on board and they can start helping you with recipes and they can start making stuff with you, it gets them excited. So that's one top tip. Make it exciting. So I like my son, he loves this snack where we'll get a celery stick with almond butter, we'll put little raisins in and they can be sailors on a ship. And I made, the other day I was trying to get him to have some avocado. I made it into a car. I kind of scooped it out of its skin and I put little wheels, what did I make the wheels out of? I think I made the wheels out of carrots. Anyway, I made a little avocado car for him. And I think things like that, I think just getting their imaginations involved, getting them enthusiastic, it really, really helps. But you have to also think about the potential pitfalls as well, because if you're doing it for health reasons, you're going to want to make sure that you prepare in advance for certain pitfalls. So kids' parties, when they're staying over at people's houses, when there are big school trips away, whether you want them to have school dinners or whether you want to make a packed lunch. You need to think in advance sometimes for some of these issues in childhood, but it's a really, really exciting way to go because it helps with short-term and long-term health. So it's fantastic.
Okay, so can you talk to us about what causes erectile dysfunction and how nutrition plays a role in either reversing erectile dysfunction or preventing it from forming in the first place?
Yeah, definitely. So erectile dysfunction, there's lots of different reasons why people might have problems with their erections. Obviously, there may be psychological reasons in some regards, but in terms of physiological reasons, a lot of people have talked about how it's a bit of a canary in the coal mine. I don't know if you've heard that, whereas it's like an early warning sign for heart disease. And this is 100% true. There's a stat going around that 40% of 40-year-olds can have erectile dysfunction. And then if you do have erectile dysfunction in your 40s, you've got 50 times the risk of heart disease. And the reason for that is because it is heart disease. The penile arteries are about half the size of the arteries that you have in your heart or surrounding your heart. So clearly, if you've got furring up of those arteries, they're not going to work so well. And you're going to know pretty quickly through your erections or lack thereof that there's a big problem. And this is so important because good sexual function is important psychologically. It's important in your relationships and your mental health. And who wants to live with the prospect of not being able to be close to their loved ones again because of heart disease that they didn't even know they had? So I think if you find that you're in a situation where you're in your 40s and you're not able to sustain an erection anymore, then it's really important to get it checked out, because the chances are you've got some issues with heart disease that's happening in your penis itself. Penile angina, I suppose you could call it. And you've got to get that sorted out. You've got to change your lifestyle, because it doesn't matter how many tablets you take. If you're taking Viagra for it, ultimately, if you end up dying early of a heart attack or you get a stroke, you're not really solving the underlying problem. So you really need to get your lifestyle and your diet sorted out so that you can enjoy not only good physical health, but good emotional health and good connection to your spouse.
Those are great tips. Let's say, okay, so our last question here. Let's say somebody is just beginning to follow a low-fat, plant-based whole food diet. What is the number one tip you would give them?
Number one tip, I think be kind to yourself. I think don't berate yourself too much if you fall over. You just dust yourself off and you start again, because every meal and every day is a new day. I think trying not to think too far into the future. Some people in their minds, they think, oh no, I couldn't possibly do it because I've got this thing coming up maybe I've got this wedding coming up in 3 months, and what am I going to do at the wedding? And people sort of put all these different blocks on themselves, these psychological barriers. And I think if you're thinking about it but you're just not sure where to go, the first thing is I really like the PCRM Power Plate. I think it's a brilliant first step, because you've just basically got 4 food groups that you're really aiming to emulate. You've got your fruits and your vegetables and your whole grains and your legumes, your chickpeas, your lentils and your beans. As long as you know that you're having all of those each day, get your recipes sorted, and you'd be good to go.
This is great. Actually, one of the things that I constantly think to myself is that this eating a plant-based diet, especially if it's a plant-based whole food diet, is actually not that hard, right? It's just like you were saying, it's pretty common for people to put roadblocks in their way, and like, I remember I used to do this a lot when I was contemplating switching over to a plant-based diet. And, it's easy to miss the forest for, an individual tree and focus on that one tree and say, oh, okay, this is the thing that's preventing me. When in reality, if you just removed that frustration, then all of a sudden you go to right? So
I call it the toxic triad: taste, tradition, and time. People thinking, I couldn't have foods that taste so different from what I like, and tradition, as in things that they've always been used to, foods that they grew up with, and time, thinking, I haven't got time to make a recipe, I haven't got time to think about it. But these are all little tiny roadblocks, like you say, they're little tiny things that you think, well, let's just sort of forget all that, just start, and then sooner or later you're going to be getting into a rhythm of things. You've got 4 or 5 favorite meals, and then you're good to go. You're rocking and you're rolling, and you're getting some success. Yeah.
100%. Yeah, it can truly just be that simple. Well, thank you so much for taking the time to be here with us today. We really appreciate it. You know, you're busy, you got a lot of things going, but what I love about one of the things I love about you is that you have such a breadth of experience here in multiple medical fields. And what you do is what I think what you've recognized is that a plant-based diet is not a solution for any one particular condition, but it's a solution for chronic disease as a whole. And so I appreciate your perspective, and I know you're doing a fantastic job out in the UK, and we really appreciate you taking the time to be here with us today.
Thank you so much. It's my absolute pleasure, and I really appreciate the job that you do. I've been telling all my patients about your Mastering Diabetes program and about your wealth of knowledge. So I think it's just so important for people to understand that when it comes to good health, you know, it's in their hands. They can feel empowered and they can just do it.